What do you gentlemen have against our traditional Indian systems? Are you anti-national?
I think, maybe the definition of what an anti-national keeps to be expanding, every couple of months. I mean, earlier
We
on,
try,
anti-national
yeah.
was kind of, limited to people who were sort of seditious, but now, everybody and anybody under the skin is called an anti-national.
I mean, a lot of what is sold under the label of Ayurvedic medicine today in India is not even Ayurveda.
Because majority of the 17,000 crore of taxpayer money that Ministry of Ayush has spent so far has been on promotion and marketing.
I went into it thinking this was non-fiction, but turns out it's a proper horror story.
One nation, one everything is worrying from several perspectives. But when it comes to drug regulation, when you have a single market, it's very essential to have a single regulator. A strip of azithromycin tablets, which were labeled at 200 mg, when they were tested, it was found that they had only 23 mg. And the way it was presented in court by the drug inspector was that, it's all right, the patient will just have to take more of the medicine. It's like,
Hi, this is the News Minute interview with the authors of The Truth Pill, Dinesh Thakur and Prashant Reddy. They've written a book about the drug regulatory system in India. I went into it thinking this was non-fiction, but turns out it's a proper horror story about the drug regulation laws, the implementation, the whole structure in the country. So thank you for speaking to me today. And my first question really is, you're making a push for centralization in your book, right? Centralization of the drug regulatory system. And this is against the currently decentralized system. And this comes at a time when the central government in India, the union government in India, is being accused of hoarding a lot of powers from states, is accused of going against federalism. So why do you believe that a centralized system in this particular instance is better than the current decentralized one?
thanks for having us here, first of all. So I understand your concerns. This one nation, one everything is worrying from several perspectives. But when it comes to drug regulation, when you have a single market, right? India is a single market in the sense that a drug manufactured in Himachal Pradesh can go to Tamil Nadu and Mizoram without any extra checks. When you have a single market, it's very essential to have a single regulator who can cut across different borders when it comes to enforcement of the law. Because what we noticed is, even when regulators in southern states, like the Karnataka drug regulator is actually not bad,
Okay.
Tamil Nadu is not bad, but they can do almost nothing to stop bad drugs coming in from poorer regulated states like Himachal Pradesh or some of the other North Indian states. And there are also jurisdictional issues when it comes to conducting investigations. Like a state government officer of say Tamil Nadu cannot go conduct a raid outside Tamil Nadu. That's how the law is written. So in most countries which have a federal nature, for example, the United States, the tendency is to have that one single regulator because it ensures greater consistency in application of the law across the board. And as of now, the central government already does have some powers. What we focus specifically is on the issue of licensing, because that's where the factories are inspected and whether inspections are conducted to see whether they're complying with GMP standards. So that has to be consistent across the country, and you cannot achieve that consistency if you have 37 different regulators operating in the same, what is essentially one market.
The other aspect of this is like when he's talking about internal implementation, right? Like, for example, in Karnataka, if you find a drug that's manufactured in Himachal, there's very little the Karnataka drug regulator can do other than basically issuing a notice, right? This actually plays out internationally as well. What you saw in the Gambian case, when the World Health Organization actually issued a medical products alert saying that these are the 4 cough syrups that were made by a company in India, because the way our regulations are structured, and the facility that made this cough syrup was being inspected by the Haryana drug regulator, the central government could very easily wash its hands off of it and basically, it's that drug regulator's problem. They didn't do the job right, and then between the two, everything gets lost, right? it provides a shield of sort of plausible deniability whenever there is an accountable situation that comes up, right? So that's one aspect of it, not just internally within the country, but internationally as well. The other argument we also make is that the fact that the drug regulator needs to be bought outside the ministry. It doesn't know. So just like we have independent drug regulators for telecom, for securities, for insurance, right, that have the ability to hire specialized skill and can be outside the purview of the ministry, right, and thereby become more effective in regulating what they're regulating, is an argument we are also making, because allowing the drug regulator to be under the confines and the thumb of the Ministry of Health really is counterproductive, because they don't really have a voice. They have to listen to the master's voice at some point, right? So that's the other argument we're making as well.
Thanks, Prashant and Dinesh. My next question really is about one of the chapters in your books deals with a lot of case studies where drug manufacturers are taken to court, and the courts are amazing, right? They get away with little to no sort of penalty.
Sure.
The maximum fine is about 1 lakh in some cases, but according to the law, it's like about 20,000. So this is in cases where the drugs are either ineffective, or they're toxic, or they're not of good quality, right? So what kind of judicial reform do you think is necessary in the country in terms of making sure that the paracetamol that I'm taking is the same as the paracetamol that you're taking, right? Like,
Well, I mean, more than judicial reform in this case, it's basically the drug inspectors and the prosecutors, they have to put up a tougher fight in court. Because what happens in these cases is the judge, usually the judicial magistrates hearing this, they are looking at what the prosecution is asking for. If the prosecution is not pressing the case and they're whitewashing these offenses, the judge will go lenient on the offender. So one of the examples that we've discussed in this case is in the book is about a strip of azithromycin tablets which were labeled at 200 mg. When they were tested, it was found that they had only 23 mg, which is basically 12% of the active ingredient, right? And the way it was presented in court by the drug inspector was that, it's all right, the patient will just have to take more of the medicine. It's like, the chini kam hai in the chai, you can add a little bit more sugar and you will get away with it. It's not going to cause any harm. But fact of the matter is, if a doctor was to administer this tablet on a patient with a life-threatening infection, the patient would die. There is no doubt about that. So over here, in this kind of case, if the prosecution had pushed and had let the judge know that this is a very serious case, chances are the judge would have stuck to the law and given the minimum imprisonment prescribed in the law, which is 1 year. So the way drug inspectors are working, and I think this has happened because this escapes all scrutiny. You don't see the media reporting on it. We were shocked when we discovered it, right? So what is happening in the trial courts a lot of times just doesn't get media attention, doesn't get academic attention. So hopefully we're hoping that with a book like this, somebody sits up and realizes that the drug inspectors are being very lenient, and that they push the public prosecutor to ask for the minimum mandatory that is prescribed in the law. I don't think there's much we can do to reform the judiciary here. It's more of a prosecution issue than an issue with the judges.
It's interesting that what he's saying. Yes, it is a prosecution issue, but one of the other things is that judicial magistrates obviously read the law, right? What we're now seeing over the last year is an active effort by the industry pushing the government to decriminalize these offenses. Right now, at least, if you're convicted of making a substandard drug, the law prescribes a minimum fine and a penalty, penal penalty for you. What they're now pushing, they tried doing this through an amendment to the Drugs and Cosmetics Act last summer, which we pushed back significantly on. The government has now, brought in what is called the Jan Vishwas bill. It has, it is looking at across many different, areas of regulation.
42
areas, yeah. And they're trying to decriminalize, this aspect of it, where the law will basically, through a mechanism of compounding, allow people who make, companies that make substandard drugs to walk away from paying a fine. Now imagine today the law is actually prescriptive of a penal punishment. that's watered down and actually made it down to essentially paying a fine, you can imagine what effect that will actually have upon the jurisprudence of this particular area.
A follow up on that.
It's okay, we'll do a three-frame question.
Yeah. Sorry. Following up on that, what is the size of these companies, right, in terms of what is their revenue and what is the size at which they're operating? And in a country, let's say like the US, where the penalties are much higher as a percentage of their profits, rather than 20,000 rupees, which will probably not make any difference to a company manufacturing several drugs. So what is the kind of system that is being followed elsewhere, and how do you think these fines should be implemented, ideally?
So, I mean, a lot of these companies which have been implicated in these recent scandals where, cough syrups have killed children are typically SME, the SME sector, small to medium enterprises. So they'll have turnovers of between, say, 10 to 30 crores, which is not very big by the pharma industry standards. So a lot of these guys would have been, originally chemical manufacturers that have worked their way up the value chain a little bit, because, I mean, your biggest input for medicine is chemicals, right? And they don't upgrade on the quality parameters the same way. So regarding fines, I mean, we haven't looked at that, but you're right, this 20,000 rupee, this thing is not going to work. In an ideal situation, it should be tied to the, percentage of the turnover of the company. But that happens that the way Indian laws are written, there are very few sectors in which that kind of penalties are prescribed. And though that if you look at them, it's actually the more recently enacted laws. For example, like, competition law, the telecom regulator, securities regulator, everything post 90s. So we need to completely rethink this 1940s era law, right, where you're just prescribing a very small penalty of 20,000, and we need to upgrade it and think about how do you actually hurt these guys financially. The way, apart from the penalties, what the Indian drug inspectors try to do is they try to suspend the license. So there is a provision in the law where you can give these administrative penalties and suspend the license, but we have absolutely no idea how that actually works or whether the company is even hurt. Because what we discovered, again, what was very surprising is there's a set of these prosecution guidelines which the drug inspectors have come up with themselves, where they've decided that they are not going to institute prosecutions in majority of the cases. Unless it's an outrageous case, they will not prosecute, and instead they will prefer these administrative remedies, such as suspending the license for 10 days, 20 days, which doesn't hurt companies, because a lot of factories in India don't work 365 days a year. They will have their cycles in which they work, or they will have like multiple licenses, say for 10 different products. So you suspend a production line for one license, they will make 9 other products. But the surest, the clearest picture of whether these licenses are being actually suspended is to see whether they are challenged in court. And when we did a search, we found only 2 judgments dealing with suspensions of licenses since 1950, which basically means it's not hurting the industry. Otherwise, they would have gone. So the big problem now in India is the law is saying something. By the time it comes down to the bureaucracy and the way they're implementing it, they have rewritten the law to a large extent.
The other challenge, which on the other side of it, what we see is, if you look at public procurement, right, central government health scheme, Indian Army, Indian Railways, majority of the procurement is from the SMEs. So you can imagine the kind of quality that they're actually getting. This is the deterrent for cost of doing business, right? You can see, what kind of quality issues that you run into.
Yeah, in fact, there was a government survey which said that 10% of all drugs tested in the government supply was of substandard quality. 10%. That's unbelievably high.
So yeah, this is one of my favorite subjects, traditional medicine, or as in the Truth Pill, you call it the Hindu medicine of Ayurveda and the Muslim medicine of Unani. So you've talked a lot in the book about how the regulatory system for these practices are also problematic. What do you make of the push for Ayush in the country? What do you gentlemen have against our traditional Indian systems? Are you anti-national?
Well, I mean, a lot of what is sold under the label of Ayurvedic medicine today in India is not even Ayurveda, because a majority of what is sold is what is called patent and proprietary Ayurvedic medicine, which are basically formulas, recipes that are not even there in traditional Indian texts, right? So they are completely new drugs for all practical purposes. Our only point is that if you're coming out with these new concoctions and you're making serious therapeutic claims, then you need to go through some kind of scientific process to establish the safety and efficacy of your drugs, which right now in India does not exist. And the reason this is becoming more of a problem in the last decade is because originally the Ayush sector, the Ayurvedic Unani medicines, they were sold more as anti-aging health supplement type of branding. That has changed in the last 10 years, Patanjali being one of the causes, but there are also government laboratories which are involved in this, where, for example, they are making claims to cure diabetes, cholesterol, liver problems, COVID, coronal, yes. So these are really serious therapeutic claims that these guys are making, and unfortunately, the scientific temperament in this country is still at a stage where, and also there are some valid reasons that I think a lot of people in the middle class see the corruption in the private health sector, so they have lost faith in it, and they are running in droves towards these traditional Ayurvedic medicines. And you just need to speak to doctors like Dr. Abby Phillips and a lot of other doctors who will tell you that these drugs are making the lives of patients even more miserable. So that is one side of the story, where these proprietary medicines that are being sold legitimately are not solving problems and making worse. The other big problem with the Ayush industry, what we have noted, is rampant adulteration, right? So you will test, there will be all these sex drugs that these Ayush guys will sell. You test it in a lab, the contents of Viagra are there in it, they're selling it at a 10x price. There will be Ayurvedic painkillers, something, a concept which I think doesn't even exist in traditional Ayurveda. You test it, you'll find nimensulide. And there are, the most popular contaminant in Ayurvedic drugs are steroids, because steroids will suppress your immune system, so there's no inflammation and you feel reduced pain for some time. So these are, the scale of the problem is humongous. And then you obviously, I think, have heavy metals, etc.
I think, maybe the definition of what an anti-national keeps to be expanding, every couple of months. I mean, earlier on, anti-national was kind of, limited to people who were sort of seditious, but now, everybody and anybody under the skin is called an anti-national, all kidding aside. The point I'm trying to make is this, right? Look, when you think about Ayurveda and the ancient texts that actually prescribe the concoctions, children's and all that, right? Remember, they were supposed to be made by a Vaid sitting next to you to be consumed immediately. Where was this concept of preservatives in there, which is what you get today to go buy off the shelf? Where is the concept of preservative in it? Then how is it Ayurvedic medicine if you add preservative into the children and the concoction that the Vaid is supposed to make for you? That's one aspect of it. And as Prashant said, where is the scrutiny? Fine, I take it for granted that you think that this is therapeutically beneficial. Fine, but where is the scrutiny from an authorized agency to be able to sort of say whether the claims that are made are actually legitimate, right? Because majority of the 17,000 crore of taxpayer money that Ministry of Ayush has spent so far has been on promotion marketing. Where is the research? If you genuinely believe that this actually adds value, to the traditional systems of medicine, wouldn't you want to invest time and effort in producing something meaningful? Because all they have produced so far is IME 9, BGR64, which have CSIF logos, which basically mean that they actually are blessed by the government of India.
Of course.
And then you have this Baba with Nitin Gadkari on one side and Harshvardhan on the other side, promoting this concoction. And if you look at the scientific literature, Abhan Agrawal, hepatologist in Bombay, has actually done a study and shown Giloy is hepatotoxic. But none of these guys who actually hawk all of this stuff want anybody to know about the hepatotoxicity of this Giloy and Swasati and whatever nonsense that they sell. Where is the scrutiny for any of that?
And we have, of course, brinjal-based eye drops to cure corona, and they want to study it to make sure that this guy did a good job of it, right? So, speaking of Ramdev and coronal, none of these magic remedies that are being sort of advertised, whether it is pure Ayurveda, real Ayurveda, I don't know, government approved Ayurveda, not Ayurveda, whatever it is, right? A lot of these things that are advertised, there seems to be little action against any of these people who are sort of peddling these magic remedies. So, what do you think needs to be done over there?
I mean, I think there's one or two things, right? One, I think that the proximity of these guys, to the power centers, that is a real conflict of interest. Why does the Minister of Health for the Union of India feel compelled to promote a product? Is that person the payroll of the company that the product is being promoted? Why does that happen? Would the minister do the same thing for a product of modern medicine? Isn't that obvious that there is something else going on there? But to answer the question you're asking, right, I think in order to answer the question what needs to be done differently, we've allocated a lot of money, taxpayer money, to this Ministry of Ayush, right? Why don't they come up with what they would actually call standards by which they would measure their own products, right? And then publish that data so that people like us and also the proponents of traditional system medicine can think about them, right? Let's see what they actually come up with. Right now, we don't even have a standard. Yes, modern medicine has a standard, but it's corrupted significantly by a regulator. In this particular case, there is no standard. So there's no standard. How do I measure quality by?
So, one of the the issue of these advertisements of Ayush drugs, it caught the attention of a lot of MPs on Standing Committee for Health in Parliament, because that Standing Committee has a lot of doctors, like a lot of the MPs who are doctors end up being on that committee, and they put a lot of pressure on the Ministry of Ayush, and they forced them to enact some rules to regulate advertising. Basically, they created a process where you need to submit your Ayush advertisements to the ministry, like a pre-censorship regime, and they have to clear it. The problem is those rules were immediately challenged before the Delhi High Court and Bombay High Court in 2019. And what was very interesting is the companies who were challenging it, Reckitt Bensinker, for example. You think that this is like an FMCG company selling like soaps and this, that for the modern market. There was some Swiss company whose name I can't even pronounce. So there are a whole lot of players in this place who have realized that there's money to be made.
Yeah.
And like Patanjali is the most visible, but there are a lot of other guys in this Ayush space. There must be, the margins and all must be huge for the kind of stuff that they're selling. So the pushback they managed to mount in court, in 2019, it's been 3 years, January 2019 was when the litigation started. Some kind of temporary stay was given and the matters have just frozen there. So the government doesn't seem to be interested in agitating these cases, because if that stay is lifted and those regulations can be enforced, then we will not see this case of where Patanjali in the last year has been on a very visible advertising spree in all the English newspapers especially, and making pretty outrageous claims about diabetes and liver medication. So those kind of advertisements would be curbed to a certain extent if those rules were in place. But unfortunately, the courts they have their own timelines for these things.
So my last question is, in one line, what's the first thing that needs to change in the drug regulatory system in India?
If you were to ask me just one thing today, right, I would say transparency. I mean, bring more transparency. I mean, just think about how they approved vaccine candidate during COVID, how opaque. I mean, MPs had to actually ask in the parliament who are the members of the subject expert committee who actually recommended the approval of that vaccine candidate. Why is that so secret? I mean, is that a state secret that we can't even disclose who these doctors are who are actually recommending the approval of this vaccine candidate, right? I think, the regulator actually worked with impunity because there is no way to hold them accountable. I mean, Prashant, I couldn't file RTIs. Most of the book is based on Prashant's work on RTIs. And what we feel is that they figured out that the way to frustrate you. You file an RTI, they send it to a different zonal office. Zonal office sends it back to another district office. The district office then, we were told that you come to our office and inspect your records, right? Or they send you like handwritten notes, like hundreds of pages. I mean, are we supposed to be digital India? Are we supposed to have all of this stuff documented, digitized right now? Why is it that we can't even disclose, on what basis that they actually thought that we had a clause like emergency use authorization, because those words don't exist in our law, right? But they were used to justify approval of the vaccine candidate, right? So isn't it important for people who are being administered that vaccine candidate to ask, okay, who are these people who said, okay, it's okay for us to go ahead and take that? Why is that a state secret? I can give you hundreds of examples like these.
Yeah, so I would make a similar recommendation. Record keeping, which is perhaps the most boring thing to sell to a general audience, is so important. And the Indian bureaucracy it does not know how to maintain records. He's not joking. We literally got 500 pages of a handwritten register in this day and age, where you can just input everything into an Excel sheet. Or why don't we have a national database? Because the government spends a lot of money, the state governments and the central government, on testing drugs randomly in government labs. But only 3 states make available the test results in a centralized database. So why don't you just make those test results available? Most importantly, are inspection reports. Every time a drug inspector goes and inspects a facility for compliance with good manufacturing practices, that inspection report should be made public. Because one, the drug inspector is doing his job, and two, how well the company is actually faring.
Yeah.
So for big purchasers, like hospitals, pharmacy chains, government departments, they can use this information to make their decisions when they're doing large-scale procurement. How it works now, it is so ridiculous. The Indian Railway sends its own people to inspect pharmaceutical plants before they purchase drugs. And we saw these inspection reports. They clearly don't know the ABCD of GMP. So you have other government agencies which are working blind because one department is not being transparent enough. And what are we trying to protect? None of this should be a state secret at all in any event.
What's funny is that foreign inspectors who come and inspect our facilities because we export to them, right? Within 30 days, they make the reports public.
Of course.
But ours are all absolutely state secret. And in addition to what he said, the procurement decisions, lay people, right? I would like to know if I'm buying medicine made by a certain company, does it have a record of compliance, right? Why is it that they can't put in, one of the things that we did when the Maiden pharmaceutical Gambian situation broke, nobody knew whether this company actually had a history. So Prashant actually went in and did a search on the 3 states that actually published that data. And we put it out saying, look, this company's been blacklisted in Kerala, it's been cited in this state and that state. That formed the basis of the reaction that actually came. Because nobody knows what do we even look for? Why is it so difficult? I mean, these are not nuclear secrets.
Thank you so much, Dinesh. Thank you, Prashant.
Thanks
And
for
this is The Truth Pill. If you guys want to read this book, it is quite a horror story. Lots of interesting facts, lots of details, case studies about a lot of things going wrong in the Indian drug regulatory system. And I think it should make us think about whether the medicines that we are consuming on a daily basis are working the same way they are for me and for you, and whether all the generics that are out in the market are as effective as they should be. So please do check it out, and thank you so much, both of you, for joining me today.
Thank you for having me.
Thank you.